Let's avoid falls in the elderly. Did you know that one out of every three people over 65 years suffer at least one injury due to falls within 1 year? That the number is 1 out of 2 in people over 80 years. Then, with increasing age, the probability of falls also increase, and that elderly females are more prone to suffer falls than the elderly males, and that 50% out of people who fall needs hospitalization, and also that three-fourths of injuries in people over 65 years are due to falls, and this negatively affects their quality of life and overall health. And last but not least, did you know that targeted remedies can reduce the injuries due to falls by 30% to 40%? So today, let's talk about reasons for the falls in the elderly, side effects of falls, how the body responds to falls, why should we prevent falls, and how to prevent falls and associated injuries. So, first we'll talk about reasons for falls in the elderly. There are bodily issues, side effects of drugs, and environmental factors. First, we'll look into the bodily issues the elderly people face. They include weakness in muscles, loss of memory, loss of coordination, and impairments in hearing and vision. Next, we'll move into the side effects of the drugs. Side effects of some commonly used drugs among the elderly include dizziness, loss of balance, vertigo, and hypertension, which may cause accidental falls. Then we have environmental factors, which act as the next contributory factor for accidental falls. Spilled water or oil and slippery floor, things like stairs without support, slippery carpets, not enough lighting, and wires on the floor can act as deadly things for our elderly population. The next thing we are going to discuss is the side effects of falls. Fractures, sprains, damages to brain, cuts and penetrations, joint dislocations, and contusions are many among the bad side effects of falls. It's important to know how we should respond when we witness a fall. We can discuss this under some subtopics. The first one, how does the fallen person should act? Next, how does the people in the vicinity of the fallen person should act? And how to give first aid and hospitalization when we see a person has fallen. First, we will see how the fallen person should act. You should never get up and try to walk if you feel any pain or issue with the body. If there is no such issue or pain and the surrounding is clear, you can slowly get up and sit on the closest chair. If there is any pain or a discomfort on the back of the neck or your head, you have to stay still. And definitely, you should call for help. Next up, we are going to discuss how you should act if you see a fallen person nearby. You have to remove any dangers in the vicinity of the fallen individual. Don't lift or seat the fallen person immediately after the fall. Observe the fallen person well and ask for any signs of pain or discomfort and get an idea about the type of injuries the person must have suffered. If you're suspecting a fracture, keep that body part still and avoid any movement. If you're suspecting any injuries to the back of the neck or to the spinal cord, keep the patient still until the patient is stabilized using a spinal board to be carried to the hospital. And if you are suspecting fractures or dislocations to the pelvis, it have to be immediately stabilized for a better recovery. Therefore, you have to take the patient to the nearest hospital as soon as possible. And if the fallen person tries to stand up or sit, if there are no injuries to the person and the surrounding is clear, you can help that person to get up and sit. If there are severe bodily pains or any visible injuries, or if you suspect serious injuries, you have to call 1990 emergency ambulance service as soon as possible. Then we are going to discuss a bit about the first aid we can give to a fallen person. If the person is not responding, first check for the throat to see if there are any obstructing things. If there is visible bleeding, give a slight pressure over the bleeding site using a finger. Now we are going to discuss why should we prevent falls. There is always a high possibility to suffer bodily injuries after falls. And injuries due to falls usually make the recovery longer. And also, falls can cause very serious side effects, which may include fractures, injuries to the scalp, reduced movements because the person might be afraid of falling again, need for recurrent hospitalizations, and even death can occur. Now, the most important part, how to prevent falls. We have to maintain a good health to prevent falls, and let's see how. Avoid alcohol and drink plenty of water, which might help you for the posture and coordination. You have to engage in daily exercises, which makes the muscles stronger. Healthy and nutritious food always makes you stronger. And get your eyes and ears regularly checked up for vision and hearing. Always discuss for the side effects of your drugs with your doctor. These things might help you prevent accidental falls. And we can also rearrange our surrounding to make it a fall-free environment. You should keep the house tidy and clean with always a good lighting. When you sleep at night, keep the lights on in your sleeping room. Use non slippery carpets and supports in the washrooms. Prevent water and oil spills in the kitchen and clean them regularly. Always use double hand supports in staircases. Use appropriate lighting in the staircases. Repair the floor for damaged areas and use non slippery carpets in the house. About the dress and clothes. Do not use long clothes which can make you trip. Do not use slippers with loose heels. And about the road safety. Always use the pedestrian crossing and the pedestrian walk. Be cautious when climbing hills or slopes. You can use walking aids and ask your doctor for the proper walking supporters. Be cautious and careful when crossing the road. Don't forget to use the zebra crossings. And we can call it a day. Thank you all for listening and watching.